That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other.
Well, hello and welcome back to another episode of the Real Health Podcast with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor. Brandi is my other half, and she's the one with all the wit. So, Real Health Podcast is where we go over the latest information and news in mainstream media about health and wellness, what's been discovered, what diseases are, being solved or found, and treatment innovations and all of that stuff. And the reason we do that is so that you won't have to do it. So we'll read all the articles, we'll summarize it for you, we'll tell you what it means, and then we'll give you our perspective as far as health and wellness is concerned, as far as how you can apply it to your life. And the purpose of why we do this is to help you feel better, get stronger, live longer, and feel younger. So,
I like feeling younger.
Yeah, no
It's
doubt.
one of my favorite things.
I was at the gym today. Two of our many favorite trainers were commenting about our podcast,
Oh, nice.
and it was pretty cool. Yeah,
That's
pretty cool.
cool.
Eric and Daniel were talking, and Eric said there was really one of the shorts he thought was hilarious. That's when we were talking about Travis Kelce and
Oh,
and his he said my facial expression when you said his girlfriend makes more money than him per minute was pretty funny. So it's nice, they're following, they're
That is
watching,
fun.
so shout out to One Life Fitness and
yeah.
the
And
gang over there.
I want to give another shout out too. We have been really blessed recently to begin building a relationship with Frederick's professional basketball team. So
That's
for
right.
those of you who don't know, we do have a professional basketball team. They're part of the TBL, which is the basketball league. And they are, let me tell you, our Frederick Flying Cows is the name of the team, and led by Coach Ed Corporal. Let me tell you, these guys are just unbelievable athletes. Coach is just an unbelievable coach. They're all great human beings. We just love them. So if you're in the office or you're driving by and you see some really tall humans, those are our flying cows. You can give them a high five or a fist bump and tell them how amazing they are, because they are.
Yeah.
And come out and see them. Go to flyingcows.com. Go ahead and look and see how
I
many
think it's
games
called
they have.
Go Flying Cows.
GoFlyingCows.com. But you'll find them. Google them. They're there. See what games are coming up. We still have some games through mid-May, and then we have some tournaments, I think, that will be going on. So come on out and see them. We are at every game. We go and adjust the players before, and then we sit there right behind them. So come up and say hi to us. Come out and support them as well. They're just fantastic. And when we get these athletic teams in our community, we really want to support them because it improves our community. It
Yeah,
creates
this
such
isn't
a
some.
good community culture.
This is not a rec league or anything. These are professional basketball players. This is their full-time job.
Yeah.
Is practice and play basketball, and then be in the community and serve the community. They've done a lot of good already. This is their
Yeah.
first season.
Yeah,
It's
they're
an expansion team for the TBL, and TBL has 38 teams,
38
I
teams, I
believe.
think,
Yeah,
currently.
the season's half over. They've played 12 games. They have won 11 of 12 games.
Yeah, it's
which is
unbelievable.
phenomenal for a brand new team that's
Yeah.
never played together. With a new head coach. I mean, he's not new. He's the winningest coach
In the
of all
TBL.
time in the TBL, and he has some ties in college basketball as well. But anyways, if you like sports, there's nothing more exciting
Yeah.
because you're right up there, up close and personal in the action. The stadium's not huge.
Yeah, it's an intimate setting, but
yeah.
it is just so fun.
The players come out and meet all the fans after the game,
Yeah.
sign, give autographs and everything. It's an experience.
Yeah.
It's fantastic.
Yeah, so come on out
I
and support.
actually enjoy their games more than NBA. And
I know.
NBA playoffs are out, and every year I love watching the NBA
Yeah.
playoffs. This year I've been so involved and excited about the Flying Cows. I haven't paid too much attention
know.
to the NBA playoffs. I mean,
Yeah.
I still look at the scores and stuff, but the games I really want to watch are the
Yeah.
Flying Cows. They're just fantastic.
So anyway, I just wanted to point that out. We should probably dive in, but I thought that was a fun little tidbit we hadn't really talked about too much
Yeah,
yet. So
basketball is our favorite sport
It
anyway.
is.
So all three of our
it's
boys.
climate controlled. That's one of my favorite
That's
things.
right. That's right. And the games end when the buzzer goes off. It's not like you can
Yeah.
have extra innings or whatever.
Yeah.
So, anyways, those are just some personal preferences. But let me tell you what's going on in the news here. This was in the New York Times, and the title article says some older women need extra breast scans, and then it says, why won't Medicare pay?
Because it's Medicare, people. Okay, I guess we're done with that article.
We're done. I'm moving on.
Sorry.
Well, it says this was published in New York Times on April 19th, updated on April 20th. Mammograms can miss tumors in women with dense breast tissue. So for those patients, doctors often include a second scan, ultrasound, for example, or an MRI, which is more likely to turn up cancers at early stages. Though many women see the extra scan as a routine form of prevention, Medicare won't pay for it, and some patients are left to pick up a hefty tab. There was a lady named Joellen Summer, 66 years old, in Manhattan, and she apparently has dense breasts and a family history of breast cancer. She said she has received mammograms and ultrasound imaging throughout her life, but I guess since she's 66 now, she's on Medicare. Correct. And they've denied it. And so this is a radiology center called Lenox Hill Radiology in New York City has started warning patients that if they are insured by Medicare, they may be on the hook for up to $450 if they receive a breast ultrasound, even if breast tissue is known to be dense and the extra scan is performed on the same day as a screening mammogram. An information sheet provided to physicians noted that Medicare does cover breast ultrasound under limited circumstances, such as to assess palpable or non-palpable breast masses, ambiguous mammograms, and other signs or symptoms suggestive of breast cancer. So if it looks like they actually have full-blown breast cancer, they'll cover the ultrasound, otherwise they won't.
I mean, let me just say, ladies, we've talked about thermography before. Thermography is a great alternative and something to add in, maybe not an alternative, but at least add it into your normal annual screening process. I would even venture to say every 6 months is wise, because thermography is actually going to go further back. We're going to be able to look at blood flow patterns in the breast to determine you cannot grow a tumor without blood flow. And so increased blood flow to certain areas can be a sign.
And I would add increased metabolic rate, increased metabolic activity in certain cells of the breast. That generates more heat. So a thermal scan can pick up that heat pattern, and there'll be red spots that show up on the breast, and that's indicative of future cancer. So what's really neat is if you get a negative, or not negative, I would say a bad thermal scan of your breasts, that doesn't mean you have breast cancer. That just means if you don't do something about it, you might get breast cancer. It's really great.
It shows increased inflammation and heat and the things that lead to. Correct. So it allows you to make changes to your lifestyle before the tumors ever even get created.
So the way x-rays work, mammograms are x-rays basically. And the way x-rays work is that these particles known as x-rays pass through the tissue, and they hit the film and they expose the film. And the more dense the tissue, the slower the x-rays pass through, or sometimes they get blocked. That spot appears white on a black and white x-ray, and the area that's not as dense, the x-rays pass through, that area appears black, and then there's shades of gray in between. And so someone who has dense tissue, dense breast tissue, then tumors, the x-rays won't be able to differentiate between that. Now,
and you are getting a level of radiation with these mammograms, so just know there may be something to sidestepping a mammogram and going straight to an ultrasound or an MRI if you know you already have dense breasts. You go, why would you even allow yourself to be exposed to that? That kind of radiation is vastly different than the radiation from our x-ray machine, because we don't need to see fine detail, like breaks and fractures and stuff like that. And so what you would get at like a chiropractic office versus something like this is vastly different. So if you already know you have dense breasts, why not advocate to just move over to one of the other testing
they
methods?
Talk about that. I'm going to mention that, the why, but I agree with you.
Well, I'm saying advocate from your perspective. Don't wait on insurance. If insurance doesn't pay, don't base your determination on that. You know, if your insurance wants you to do something else, don't base your determination on that. Advocate for yourself and ask for what you want and what you need.
Yeah, fight it. While density declines with age, nearly half of women aged 40 and older who get mammograms are found to have dense breast tissue, according to the National Cancer Institute. That means half the women who have mammograms aren't getting accurate data from those mammograms. And if that's all they're getting, their cancer will develop and be in a late stage before the mammogram picks it up. Starting in September, all mammography centers in the United States will be required to inform patients who are screened for breast cancer if they have dense breasts. The effort to draw attention to the shortcomings of mammograms for these patients was started by women who own whose own cancers were detected at a late stage despite regular mammography. So these are women who were getting regular mammograms, and the mammogram didn't show their cancer until it was late stage. And
Can you believe after this has been around so long, we're just now having people advocate for this and just now giving informed consent? Coming from a family with a deep history in cancer, that's unsettling to me. Do you know? It should be to you guys too.
Says women with extremely dense breasts have twice the risk compared with those who have what is called scattered dense tissue, or dense tissue here and there in the breast, studies have found. Mammograms alone are incomplete screening. This is a doctor said this. She is chief scientific officer of the Breast Cancer Research Foundation. In women with the densest breasts, mammograms will miss about half of cancers present. Half. This is the same person. This is a different person. Joanne Pushkin, executive director of Dense Breast Info, that's an organization and educational group. The organization is supporting the Find It Early Act legislation proposed by Representative Rosa DeLauro, Democrat of Connecticut, and Representative Brian Fitzpatrick, Republican of Pennsylvania. The measure would ensure that all health insurance plans cover screening and diagnostic breast imaging, including mammograms, ultrasound, and MRIs, with no cost sharing. So this is, where I go, like you said, skip the mammogram and just go straight to the why doesn't everybody just get a breast ultrasound, and if you see something funny, then do the MRI? Forget the mammogram. There's no radiation, or there is a little bit of electromagnetic radiation with ultrasound and MRIs, but it's not as bad as the X-rays. Not that the X-rays are terribly bad, but if someone is susceptible to that radiation, for that person it's too much. And if half of them are getting missed anyways, then go to something. And so in the article, they said the American College of Radiology says that 3D mammography increases the number of cancers that can be seen without additional testing, and that ultrasound and MRI scans can help find cancers that can't be seen on a mammogram, which makes sense. But neither the American College of Obstetrics and Gynecologists nor the U.S. Preventive Services Task Force has endorsed additional breast cancer screening methods for patients with dense breast. There's insufficient data from clinical trials to do so, the group says, which is ridiculous. There isn't. Why wouldn't you go with something more accurate? Now, they say there are also disadvantages associated with supplementary screening methods, such as a high rate of false positive with ultrasounds, which cause unnecessary anxiety and follow-up care, and the high costs associated with it. So they're saying the MRI costs too much. The ultrasound doesn't, but the MRI costs a lot. And they're saying you'll get a lot of false positive. But I'd rather get a false positive than a false negative.
That's what I wrote down too. I'm like, give me a false positive any day of the week.
Any day, yeah, because then they go, there's a possibility of something. We see a spot on ultrasound. Let's do the MRI. The MRI comes back, says it's nothing. Don't worry about it. Good. So between the time you had the ultrasound and the MRI, you worry about it, but then your worries go
and
away.
I guarantee you, I would pay the cost out of pocket of an MRI 100. And by the way, people, let me tell you, I would rather pay a cash fee for an MRI
Yeah.
than I would to put it through my insurance anyway. Every single MRI location has a cash fee that is available to you.
Multiple times I've wanted an MRI, so I write my own script. Being a doctor, I can order it for myself. Remember, I was getting those headaches, exertion
Yes.
headaches. Every time I picked up anything heavier than a cell phone, I would get a headache right here. So weird. So nothing was helping me. So I thought, it must be some kind of a brain tumor. So I ordered a brain scan for myself. I went to the radiology center. I said, "Here's my script," and they said, "What insurance do you have?" I said, "I don't want to use my insurance. Just want to get the scan, and I want a radiologist to read it." And they literally reduced it
It was a
from
fraction of the cost.
like it was $1,500. They reduced it down to less than $500. I think it was
Yeah.
$450.
And you will gladly pay
Yeah.
really any dollar amount out of pocket to then have a proven,
Right.
like, no, I'm sorry, you are okay. I will pay $500 to have somebody tell me I'm okay, and I would much rather have that than go 4 years down the
And
road and go, I'm
listen.
so sorry we missed this. You now have
Yeah.
6 weeks to live.
And I don't want a brain scan to be on my medical records either.
Correct.
It's not on my medical records because I paid cash. So there's no record of it. There's no insurance paper trail that says, and then the scan was negative anyways, but you apply for life insurance later and they go, "Oh, you had a brain scan? You must be sick. Oh, your premiums are going to go up."
Right.
I don't want that. So anyways, there's a lot of benefits to just staying out of the system. Of course, it costs money,
Right.
but we have an article coming up about cost, I believe. And we can certainly go through that because apparently Medicaid dropped a lot of people. So we'll look at that article. This one is, go ahead.
Can I just say one more thing about this? I just want to point out that this is what we hear every time there's a slowness in approving something that would be better for the general population or for a group of individuals, or what we see and what we're reading most of the time is this is the kind of the catch-all, or I'm just going to call it what it is, a cop-out for not doing the right thing. Is they state, and there's not a universal agreement on the value of alternative screening. So what they're saying is, until we can get every single entity to agree that this is really what's best, we already know it's what's best. We all as individuals, it's not, you don't even have to have a doctorate to determine that this kind of testing is actually better for everyone. So, but they're going to wait until they can get every entity to come on board. This is why you have to be an advocate for yourself. So I just wanted to wrap that up.
I think we should skip to that other article about Medicaid. So go to the NPR one. The title of it is "Florida Kicked Their Son Off Medicaid in the Unwinding, but Not Their Daughter." So you're wondering, what is an unwinding? Well, at the end of COVID, Medicaid had taken on a lot of people who are in need of financial assistance. And then in April of 2023, they dropped everybody, and they said, reapply and we'll consider you. So this family, this person's name is Indira Navas of Miami, found out that her 6-year-old son, Andres, had been disenrolled from Florida's Medicaid program when she took him to a doctor appointment in March. She had scheduled Andres' appointment months in advance and is frustrated that he remains uninsured. Meanwhile, Navas said the state could not explain why her daughter, Camila, who is 12, remained covered by Medicaid, even though the children live in the same household with the same parents. The Navas family are among millions of Americans caught in the bumpy Medicaid unwinding playing out across the country over the past year. Nearly a quarter of adults disenrolled from Medicaid say they are now uninsured, according to a survey released April 12th of this year. That details how tens of millions of Americans struggle to retain coverage in the government insurance program for low-income people after pandemic-era protections began expiring last year. Nearly half of people who lost their government coverage signed back up weeks or months later, suggesting they should never have been dropped in the first place. Adrienne Hammer, 49 years old of Plymouth Meeting, Pennsylvania, says she struggled to enroll in an Affordable Care Act marketplace plan this winter after the state informed her that she and her 2 children no longer qualified for Medicaid. Hammer, who works as a home health aide, and her children were uninsured in March. But since April 1, they've been enrolled in a marketplace plan that, with the help of government subsidies, costs $50 a month for the family. Of adults enrolled in Medicaid, before the unwinding, about 35% who tried to renew their coverage described the process as difficult, and about 48% said it was at least somewhat stressful. Now, about 56% of those disenrolled say they skipped or delayed care or prescriptions while attempting to renew their Medicaid. So they didn't get health care through that period of time.
Right.
Most of them didn't even know they had been dropped from Medicaid until they went to the doctor. So can you imagine?
Yeah.
Like, you take your child to the urgent care or an emergency room for an emergency, and they go, "Oh, you don't have insurance." They go, "No, I do. I have Medicaid." And they say, "No, you don't." And that's when they found out, like, no one really told them.
Yeah.
They say they try to inform everybody, but they're too busy. And the reason, just so I don't read too much of this article, the reason that the thing was so difficult, re-enrolling was so difficult, was because they're so busy, they're not answering the phones. So people are like, when we keep calling and we can't get in, we can't fill out the forms, they won't accept the papers. You know what I think? Can I tell you what I think about healthcare?
Please.
So I'm a capitalist. So I like the concepts of capitalism. I like competition in capitalism. I think that increases quality and reduces cost when there's competition. And so we should have certain doctors that are cheap and they charge less, and certain doctors that are extremely expensive and they charge more. And everything in between. And we should choose who we want to go and see, and based on what we can afford. Now, having said that, I also don't believe that the government should not be helping with healthcare. And so from that tendency, when it comes to healthcare, I do have some socialistic tendencies, but only with healthcare, nothing else. Everything else should capitalism. With healthcare, I don't want a socialist system because there's a lot of problems with that. Like, you look at Canada. There are people who need knee replacement surgery who are denied.
Correct.
Because they go, "You're not old enough. We can't afford it right now. You have to wait." There are people who have needed knee replacement surgery for 2, 3, 4, 5 years.
Yeah.
And they're just waiting. There's people who need an MRI and they just wait and wait and wait till it gets approved. Socialist healthcare.
There are issues with it.
Terrible, terrible issues, and it's bad. So here's my suggestion. I think we file taxes every year, don't we?
We do.
The IRS looks at all of that.
Supposed to.
And we pay what we owe. Now, what if there was just a line item on our IRS forms, not Medicare, not Medicaid,
Correct.
not any other federal employee plan or any of that stuff, but there was a line item that said, "Hey, based on your tax status, your income, you can afford this many dollars per year on healthcare. This is what we think you can afford." So this is, let's say, your discretionary income. Let's say you have $1,000 a month discretionary income. They say you should set aside $100 of that for healthcare every single month, so you can afford up to $1,200 a month based on your income. Now, they talk about the poverty line, and we're going to get to that. But so let's say, based on your taxes, your expenses are too high, and you can't afford a single dollar towards healthcare. Well, then your number would be zero. And someone who's very wealthy, a billionaire, their number would be $5 million. Up to $5 million of healthcare cost, you got to pay out of pocket. The rest of it, the government will assist you. Now, the assistance comes at the form of a loan, 3% interest. This is my suggestion. That whatever inflation is, whatever the consumer report is, however prices are going up, that's the interest rate the government would charge. 1%, 2%, or 3%, depending on the year, and that's it. Now, that stays on you. Let's say you needed $10,000 of healthcare this year, and according to your taxes and according to the IRS agents that looked at it, you can only afford $1,000. So you have $9,000 that the government loaned you at 3% interest that sits on your account. Now, when you pass away, it goes to zero, but I still believe it's going to cost the government billions of dollars just doing it that way. They are spending so much money. First off, you wouldn't need all these regulators who look
Correct.
at Medicare, Medicaid, all that stuff, and who qualifies, who
And
doesn't
who
qualify.
can't call people back.
Let everybody be in the same boat. Based on your taxes, can you afford healthcare? If you can't, the government will loan you the money, unlimited amount, 3% interest, and they'll determine what you can pay back, as little as $5 a month. Anybody can afford $5 a month. You start paying $5 a month towards a loan, and if you haven't used it, then you shouldn't be paying.
Right.
We pay for insurance every single month.
And we
Most
rarely
people
use it.
don't use it. Where does that money go? In the pocket of the insurance companies. And then they take our money and they use it on someone who doesn't take care of themselves, who gets sick.
Correct.
Now, I'm not against sick people, but this would incentivize all of us to take better care of ourselves so we
100%.
wouldn't get sick. Anyways, that's my suggestion. So this
Great.
article talks about 40 states have expanded Medicaid to cover everyone with an income under 138% of the federal poverty rate. So, or $31,000. I think federal poverty rate is like $25,000, $26,000. So if you make less than $31,000 for a family per year, you qualify for Medicaid. The KFF survey found that nearly 1 in 3 disenrolled adults discovered only when they sought health care that they had been dropped. The sheer volume of millions of people being redetermined for eligibility has overwhelmed some state call centers trying to support enrollees. They have failed to communicate with people. So, anyways, that's
messy.
Medicare and Medicaid for you. Neither one's doing a good job, in my opinion, and they're spending a ton of money. So next. This is from Fox News. It's actually a Reuters story. It says World Health Organization experts reach landmark agreement on how to define airborne diseases. I thought this was a little funny. Actually, because there were 2 articles about the same subject. One is in New York Times. The New York Times one actually gave us better data. When I read just the Fox one, I started to laugh a little bit because you would think the word airborne is self-explanatory enough.
It's not.
But they had to define it.
It took a lot of people to define it too. So, and well, I will say this though. After seeing what we all had to go through in watching groups trying to determine what was safe and wasn't safe, especially at the beginning, even towards the middle of COVID, it was, if it wasn't so ridiculous, it would have been fully laughable. But I think definitely we should be coming together to create some of these definitions, and maybe in the moment of something happening in our world, we won't have to spend time on silly rules and laws that actually are so arbitrary. We hit that so much.
Part of the problem is we spend so much time trying to define something and we don't talk about solutions.
Well, I
which
agree
is
with
what
that
the article
too.
says at the end of it. It's like, okay, now that we know what the definition of an airborne disease is,
Yeah. What do we do
what
about
now?
it? Yes. Which is
Anyways.
always where we should begin, is how to fix the problem. I mean,
Why do we have to categorize everything? Anyways, so it says WHO, World Health Organization, the WHO, broadens definition of airborne diseases. In the early days of the COVID pandemic, a team of scientists called on the World Health Organization to acknowledge that the disease could spread through the air. Initially, the agency rebuffed them. Despite growing evidence that coronavirus-laden droplets stuck around in the air, making indoor spaces hotbeds of infection, the researchers responded with a public campaign, which helped persuade the World Health Organization to finally acknowledge in late 2021 that COVID was airborne. The WHO's previous stance was that only a handful of pathogens, those that travel in small droplets and spread across long distances like tuberculosis, could be considered airborne. But the new report suggests broader categories that do not rely on droplet size or distance spread. Such changes were contentious because they raised the prospect that more diseases might now demand costly control measures such as hospital isolation rooms and protective gear. So that's what they're worried about, is cost.
of course, it's at the root of everything.
Because they broadened the definition, to include more diseases, and now they have to have these isolation rooms and things like that. Before the pandemic, the WHO and other agencies typically recognized a few ways diseases could spread. One was by contact transmission, in which someone picked up a pathogen either by touching an infected person directly or through contact with a contaminated surface. Then there was droplet transmission, which involved the short-range spread of diseases when people coughed or sneezed. Droplets larger than 5 microns or 5/millionth of a meter, which then landed directly on a victim's mouth, eyes, or nose. And then there was airborne transmission, which referred just to a handful of diseases that spread in droplets smaller than 5 microns, floating for long distances until someone inhaled them. When COVID emerged, the agency said it was likely spreading over short distances, either through contact or droplet transmission. There is little scientific basis for the 5 micron threshold for small droplets. Larger droplets can also stay afloat for long periods of time. The researchers argued that short-range infections were not proof that a disease spreads only through coughs and sneezes. In fact, people can also exhale droplets through breathing or talking that are then inhaled by others nearby.
I don't know about you guys. Do you even want to stand next to someone anymore? Someone's droplets on my mouth does not sound exciting.
Hold your breath. I'm going to pass by you for a second. Don't breathe. Okay, now you can breathe. The new report did not make any recommendations for how the agencies should stop diseases from spreading by these different routes. The authors acknowledged that they had been unable to reach a consensus at this time, which baffles me. You spend all this time saying, okay, we're going to call the 5 microns and the below 5 micron droplets all airborne. Okay, but we don't know what to do with it, and we can't come up with a consensus. Traditionally, hospital guidelines for controlling airborne diseases have called for expensive measures such as isolation rooms with negative air pressure, as well as N95 respirators and other protective gear to avoid inhaling fine droplets. But it is not clear which diseases warrant that kind of control or what efforts should be taken outside of hospitals. So basically, they lumped it all together into airborne, but now they're going to go back and divide it back up and say this one needs an isolation room, this one needs a ventilator, and this one just needs a mask. Dr. Walter Zing, I like his name, an infectious disease expert at the University of Zurich and a member of the advisory group, said the old categories offered more straightforward guidance. Staying a few feet from someone coughing and sneezing was once thought to be an effective way to avoid droplet transmission, for example. It was simplistic and probably not true in a way, but it served a purpose, he said. Now we have to bring other variables to the table. Scientists are still debating the extent that influenza, which has been studied for more than a century, spreads by air. So there you go. Even the flu, influenza, they still don't know what to do about stopping the transmission of it. Listen, people, improve your immune system. You've got this like innate, God-given ability to fight infections.
100%.
Believe it or not, babies are born in hospitals. Hospitals are infested with bacteria and viruses. You cannot stop it. You can't see these things. They're everywhere. So you think about it, a brand new baby comes out of the birth canal. First breath he or she takes is packed full of billions, maybe trillions of bacteria and viruses going into this brand new sterile baby. And they all live, for the most part, 99.9%, they all live birth. That first breath, they survive it. Why? Because they have an immune system.
Correct.
And they develop that immune system. And that's why somebody gets more sick than other people.
Yes.
That's why we do heart rate variability tests in our office.
It is.
So the same story was in Fox News. The title was World Health Organization experts reach landmark agreement on how to define airborne diseases. Landmark. What's so landmark about it? The WHO and around 500 experts have agreed for the first time what it means for a disease to spread through the air in a bid to avoid the confusion early in the COVID-19 pandemic that some scientists have said cost lives. And basically, it's the same thing, except it's even worse. It just says they spent a ton of money and time to figure out that it's all airborne.
So I don't think we need to spend any more time on it because
Yeah.
they did plenty already.
They did talk about some blood-borne viruses, so things can be transmitted through blood, like HIV and hepatitis B.
We all know.
And yeah, so anyways,
All
and
right.
those things are treatable. Are we set? Are we done?
Think so.
Okay. We got lots of stuff for next time, so please tune in.
Definitely.
There's some AI tools we may want to talk about. I'm not sure. A month ago, a little over a month ago, Oprah made a lot of noise with her weight loss, and she's really promoting these
Weight loss drugs.
yeah,
Yeah.
the new class of weight loss drugs. And so anyways,
These are the same ones we've been talking about.
we may want to talk about what Oprah is doing. I don't know, but we'll see. There's a lot of articles, a lot of news. Something good comes up, we'll skip to that and then come back to some of these. But anyways, I hope this has been helpful to you. We appreciate you tuning in, and check out the Flying Cows in Frederick. If you're in Frederick, come out and watch the game and hang out with us. And check out One Life Fitness too, because those guys are awesome.
Yeah.
If you go, get a trainer. Go to the EP section, explosive performance section. Talk to Eric, Daniel, Randy. Those guys are awesome, and they can help you come up with a program and get in shape and all of that. Because exercise does boost your immune system, and then you won't be so worried about all the stuff that Medicare and Medicaid will and won't cover.
Yep, and it'll make sure you're feeling good. So as the weather's getting nice, we all need to be outside to start increasing our vitamin D levels back up. So this is our time. This is your season to begin building your immune system really well for the fall and the winter of 24. That's the year we're in. So we can make it a better winter. But we got to start now. It's super important.
All right, good show. Thank you.
See you next time.